and welcome. If you've just tuned in, you're watching Focus On with me, Keamogetswe Mosepele. Today is the last day of the Africa Health Exhibition, and today we're back with more coverage on Africa's biggest health conference. Today we profiled Fujifilm, a company you may know for your latest camera and gadgets, but they're also involved in medical devices and technology, as well as profiling a non-profit organization that is involved in penetrating rural communities and providing critical services that they may need by the name of Flying for Life. Stay tuned. I am now joined by Helen Brown. She is the General Manager for Fujifilm Southern Africa. Helen, thank you so much for your time.
Thank you.
I understand Fujifilm is a sponsor. Why that decision?
So Fujifilm the name Fuji has been associated with cameras, imaging and printing. And not many people know that we actually have a very strong medical portfolio of medical equipment and solutions, including some IT solutions.
And what has been your experience? I understand today is the last day of the event.
So we've had a tremendous amount of customers coming through our stand, looking at our products, speaking to us. We've had ministers of health themselves coming through, entourages of ministers of different surrounding countries. So that's been really incredible for us to get that visibility to the ministers of health, which is not easy to always get.
I just want to chat about how medical supplies and equipment can be adapted to the highly mobile African population.
This is one of the examples. This is actually a portable X-ray machine. Okay, it looks like a big camera, right? So you point it to the patient, you put a panel behind the patient to grab the image. So we're using it at the moment. To give you an example, is we want to get healthcare to the rural regions. We're very committed to universal healthcare for everybody. So we have sold into Lesotho 2 of these already, and they're actually on donkeys and in suitcases, and they're taken into the rural villages. And all the people there are screened. They can be screened for TB, they can be screened for any broken bones. We also have laboratory blood testing solutions. So for example, we've developed a TB test, which is done on urine. So you don't have to draw blood from the patient. So it's non-invasive, can be done anywhere, and especially for HIV patients who are immune compromised already, the doctors can check if they have developed TB because of that as well.
And you mentioned access for rural populations. One of the suggestions are telemedicine and mobile services. Can you just chat to us about Fujifilm's involvement in such cases?
Right. So Fujifilm is also very strong with our software and IT solutions. In Namibia, for example, we are installing our system in 5 hospitals, and each hospital can talk to each other, and they're a couple of 100 kilometers away from each other. And they can share images taken from CTs or X-ray machines to each other all over the country, which also enables us to have the electronic medical record. So patients don't have to be given multiple X-rays or multiple surgeries, because whatever has been done on them is readily available on the next hospital's information system and our software.
And I want to speak about data analytics.
So we know that data is very powerful. And if a hospital or hospital management has access to good, clean data, they can make better decisions about their patient workflows. They can make better decisions of which doctors should be allocated to what work in the hospitals and to which hospital. And the data analytics also allows the healthcare management to see where the facilities should be, because they can see from the data analysis more patients in this area or more patients in that area. So number one, it can increase the amount and the volume of patients you can manage, because you've got data, which is great knowledge, and also analyze post analysis to see if you have been effective. And also data allows the doctors and economists to really see what are the major diseases that are trending, are the therapies helping. So it's a really powerful.
And I know one of the trending topics in the technology sector is artificial intelligence. I'd just like you to walk me through some of the regulatory environment surrounding artificial intelligence, particularly in health.
Yes, so we do have AI on our platforms, but I do believe AI generally worldwide should be regulated. to defend the patient from any kind of misdiagnosis, which could be due to algorithm biases in artificial intelligence. So for me, artificial intelligence should never be used on its own, but in conjunction with a medical registered practitioner for diagnosis.
And I want to speak about some of the developments in your company. I understand you opened your head office recently, and this also marks your 10-year anniversary being in South Africa in particular. What has been your experience of the South African market?
So first of all, we've put a head office in Sandton because we are very serious about doing business in Southern Africa, especially South Africa. And my experience in the industry and with Fujifilm is, and I think people need to understand this, is that the facilities in South Africa are world-class facilities. You have some world-class facilities in the public sector, and you have world-class facilities in the private sector. And I've been to over 32 countries in the world looking at healthcare facilities, and I can tell you that South Africa is the most advanced, have amazing skills of medical practitioners. So that's a very, very experienced and good market.
So I understand you have been singing the praises of South Africa, but what would you say is something that the country could improve on in terms of meeting their health outcomes to be on par with the more developed nations?
So I definitely think there's a lot of talk around the NHI, and we as private sector and businesses want to help and partake and support that process because we want to get universal health care to the patients all over Africa. I do think, though, there are more skills required in building up NHI, more experience required, and more skills to assist the government to implement NHI. And the private sector is actually geared up to really support the government's plan on NHI because they have a lot of experience, they have a lot of equipment, and they can be a service provider to NHI, which would help us to actually get NHI moving quicker.
I'm now joined by Maxine Holman. She is the CEO of Flying for Life. Maxine, thank you for joining us.
Thank you so much for having me.
I just want you to tell us about your company. Who or what is Flying for Life?
So Flying for Life is a South African Section 18A public benefit organization. So we're a non-profit organization that works in South Africa. What we do is we use aviation to get into rural communities to help with rural community upliftment. We focus a lot on the medical side, on healthcare and improving healthcare in rural communities. Sometimes rural communities in South Africa don't have the skills needed to look after the community. So in those rural communities and in the rural clinics, they have a lot of nurses, but there's no specialists like GPs or dentists or optometrists. So we assist in bringing those specialities into those communities that are difficult to reach via road.
So I understand you're an exhibitor right here at Africa Health Exhibition. What are your key takeaways from the past few days?
Well, we've had a lot of people coming to us and wanting to volunteer their time, specialists that want to get involved in rural community upliftment. And for me, I think that's been such a big takeaway, that we've got lists and lists of people that have written down their names to volunteer for us and to go into the rural communities and help.
So I understand you primarily service rural communities. What are some of the unique challenges you face operating in a space that is under-resourced and does not really have a lot of support?
There are many challenges, but I suppose it's getting the volunteers that have time to come out to those communities and help, and also to find a sustainable way to continue the work. So we work very closely with Department of Health. We try and build a relationship with Department of Health because we know that is where the sustainability comes. So it's to really support the healthcare system that is already there and bring specialists and also just bring awareness to the needs of people in rural communities. A lot of people, I suppose, when we live in Joburg and we drive around, we see that there are people that are living in informal settlements that need help, but we don't realize that the people that are living in rural communities, they have to travel long distances to get the help that they need. So I think it's that awareness and bringing that awareness to people and getting the assistance that we need from volunteers.
So before we draw our conversation to a close, I know that you have a big announcement that you'd like to share with us. Just let me know about this big piece of paper that has been sitting quite comfortably next to you.
Yes, this has been an amazing encouragement to us. Africa Health has sponsored Flying for Life with this beautiful check. And it's a partnership that we started last year, where we started just communicating and say, this is who we are, this is what we do. And Africa Health, because of the similarities between our drive and what we're trying to achieve, they decided that actually Flying for Life is a great initiative that they want to get behind. So we're really encouraged, and even just the platform that we have been given to access volunteers and specialists has been amazing. So yes, this is amazing, but I think for us it's the human capital, getting those those volunteers that are going to come and help us and go into those rural communities and help. So this is amazing, and this will help always. Finances always help. But yeah, we always need people. I think our human resources is a big thing for us as Flying for Life.
And that's how we wrap up the final day of the Africa Health Exhibition, hosted right here at Gallagher Estate in Johannesburg. From myself, Keamogetswe, it's goodbye for now.